Thank you. Good afternoon, everyone. My name is Nidaf Said, and I'm a researcher at the Institute of Epidemiology and Healthcare at UCL. And this presentation is based on some of the findings from my BSc dissertation research. So the paper I'm presenting today is co-authored with Dr. Stephen Jivraj, and it's entitled Assessing Changes in Neighborhood Satisfaction Among Older Age Adults Using English Longitudinal Study of Aging. Next slide. So just to give a brief introduction, the aim of this research is to understand which type of factors affect changes in neighborhood satisfaction in order to inform public health policies linked to aging well. Neighborhood satisfaction is an indicator linked to where you live, and it's really where respondents give information about attitudes to the local area, and there are quite a few differences between the objective and subjective measures. So in our study, we use data from the English Longitudinal Study of Aging, waves 1, 3, and 7, based on information on changes in older populations in England. The longitudinal nature enables direct comparison between the two time points. And hopefully this will provide some novelty because our previous work, for example, by Gurwani et al., focused on objective and subjective measures of neighborhood deprivation. There's really been little work that looks at factors that affect neighborhood satisfaction. Slide. And again, just to give a sort of brief overview of the literature. So in the early 2000s, we had, there was a general concern for managing health and well-being among older age persons in the global context of global aging, and this led to search for age-friendly cities, which is an approach that combines two literatures. So suggesting an ecology of aging with both subjective and objective components, neighborhood satisfaction that can contribute to different environmental worlds, and also exploring the ways in which old persons perceive their local environment. This also involved a focus that has been on access to services and walkability, built environment characteristics, social exclusion, socio-demographic factors, and neighborhood deprivation. And from this, neighborhood satisfaction really emerges as a key indicator, which is linked to three broad categories: neighborhood factors, individual characteristics, and neighborhood perceptions. And this told us a lot about the role of structural, socioeconomic, and demographic factors, such as residential mobility and tenure status. And through this, we noticed that questions of the effects of affluence, neighborhood perception, social networks, tenure status, and the residential environment and individual circumstances really emerged. So just to briefly summarize, there have been different approaches to data and sampling. Some used small samples and others combine objective and subjective measurements. Our study is in line with Gurwani et al.'s 2019 study, which uses the ELSA data to calculate neighborhood dissatisfaction scores and look at a range of determinants. So from the background and literature review, that led to a sort of broad research questions. So how is change in neighborhood satisfaction over time affected by levels of deprivation, individual housing tenure status, social participation, when controlling for health and well-being, and social demographic characteristics. So the methods, so just again to give a broad overview, as mentioned before, this uses ELSA, and that was specifically for its benefits as a prospective population-based panel study, which allows in-depth exploration of change in population characteristics over time. ELSA collects information that covers health, well-being, and socioeconomic circumstances of a representative sample of the English population aged 50 and over through face-to-face interviews and self-completion questionnaires on a biannual basis. In this paper, we used ELSA because it's particularly useful as we could explore the links between neighborhood satisfaction and deprivation because of the information on life satisfaction, housing, tenure, socio-demographic characteristics, and health-related indicators. We've specifically used data from wave 1, wave 3, and wave 7 because respondents when we asked about the attitudes towards their neighborhood in these waves. And in addition, we also have the added value of ELSA being linked to the UK's index multiple deprivation, which provides information on 7 domains of neighborhood deprivation. We'll go on to that a bit later. And also, just to summarize, there were, at the start of the study, we had about 11,400 participants who entered the survey at wave one. And we made a decision to exclude some of the respondents who entered the study after this wave, since they'd be missing data. And also, just to mention that the longitudinal attrition was quite substantial. So we had 7,535 participants left at wave 3 and about 5,000 at wave 7. So this is our outcome variable. So it's composite neighborhood satisfaction score, created from the responses to 9 items on the ELSA questionnaire, which from the question on how do you feel about your local area that is ever within a 20-minute walk about a mile from your home. And that covered feelings of longing, vandalism, graffiti, loneliness, trust, safety after dark, friendliness, fairness, area cleanliness, and other people to help you. And for each item, respondents were asked to rate the area between 1 and 7, and adding on a Likert scale, adding up to score about 63. And higher scores indicated greater levels of neighborhood satisfaction, and we just used reverse recoding to make sure all responses were in the same direction. So on to explanatory variables. So explanatory variables were in 7 key areas. So residential stability was measured using a binary indicator determining whether respondents moved out of their place of residence between wave 1 and wave 7. And we also looked at how many years they'd lived at their current residence. Social engagement, community participation was measured from a composite engagement score created from questions about 8 areas. So their involvement in political parties, or tenant residence groups, church or other religious groups, charitable organizations, education, sports clubs, and any other organizations. And that was collated to create a composite social engagement score of 0, 1, 2, or 3, quite similar to the approach used by McHugh Power et al. 2019. We had neighborhood deprivation, as mentioned earlier, was measured as 5 quintiles of deprivation based on the index of multiple deprivation. And that really covered the income deprivation, employment deprivation, health, education, skills training, barriers to housing, and living environment deprivation, as well as crime. Health and well-being was measured through the CAS-19 quality of life scale. So CAS-19 measures, the CAS-19 score summarizes respondents' control, autonomy, pleasure, and self-realization. And that was summed up on a scale of 0 to 57 from items asked in the self-completion questionnaire. We had levels of physical activity measured by the amount of activity in occupational working or recreational activity, and that was categorized as low, sedentary, moderate, or high. Socioeconomic status was measured by education level, by the highest level of qualification, non-pensional wealth categorized into 5 quintiles, and housing tenure, which is collapsed into outright ownership with a mortgage, and renting. And we also had the 7th category, which was individual demographic characteristics, including a respondent's age at waves 1, 3, and 7, so between 50 and 99 plus. Sex, whether they were male or female. Ethnicity was collapsed into white or other, and country of birth, UK born or non-UK born. So just to give a brief overview of the statistical analysis used, this is really my co-author's area of expertise. But the study deployed a multi-level growth curve model where survey responses at waves 1, 3, and 7 were nested within respondents. We had the random variance terms for each wave were different. The models were fitted using the mixed count and stata, and we also tested the model for multicollinearity using the variance inflation factor test. Non-pension wealth was shown to have a high multicollinearity, and therefore we excluded that from the model of interest. So I'm now moving on to the results from the study. And in the first slide, you can see we've just summarized the findings for neighborhood deprivation and the overall wave. So the increase in neighborhood satisfaction generally increased for each wave between waves 1, 3, and 7 when holding constant all other variables. There was significant random variance around this change, which is smallest wave 3. The relationship with neighborhood deprivation was that the relationship between neighborhood deprivation and neighborhood satisfaction showed that poor neighborhood satisfaction for those living in more deprived areas at wave 1. For example, if you lived in a neighborhood with a deprivation score in the lowest, in the most deprived, compared with least deprived, that was associated with the neighborhood satisfaction decrease of about 4.38. And the difference between the 60% most deprived areas was the most statistically significant. In terms of residential stability, social inclusion, and relationships, whether response moved home between waves 1 and wave 7 was associated with a lower neighborhood satisfaction score compared to those who did not move. The number of years lived at the current address in wave 1, however, was not significantly associated with neighborhood satisfaction. We found that engagement with many social activities was associated with a higher neighborhood satisfaction compared with those who not engaged in any social activities. And finally, being single, divorced, or widowed was associated with lower neighborhood satisfaction compared to those who were married. On the third slide, we have the CASP-19 scores measuring quality of life, which found to have a statistically significant association with response level of neighborhood satisfaction. So unit increase, for example, in CASP-19 scores was associated with 0.26 increase in neighborhood satisfaction. There was no association found between physical activity and neighborhood satisfaction, and there was no statistically significant association found between neighborhood satisfaction and levels of qualification tenure status. Apologies, I seem to have missed out the next slide, but just to give you a summary, age, sex, and country of birth were all significant predictors of neighborhood satisfaction. So, for example, a 1-year increase in response age at each wave was associated with an increase in neighborhood satisfaction, and being male as opposed to female resulted in a decrease in neighborhood satisfaction, and also those born overseas as opposed to in the UK had a minus 1.13 decrease in neighborhood satisfaction. So just to give a discussion of these results, hopefully this paper makes a novel contribution by looking at neighborhood satisfaction longitudinally using a nationally representative study that includes wealth measures shown to be associated with neighborhood satisfaction. So our paper suggests that neighborhood deprivation is a key channel through which neighborhood satisfaction changes over time, in line with Goodwani et al. 2019. Fixed demographic characteristics such as age, gender, and country of birth are associated with were also found to be associated with neighborhood satisfaction, as well as potentially modifiable risk factors such as the level of social engagement, social support, and quality of life. So whether a respondent moved was also associated with neighborhood satisfaction. And while literature suggested that socioeconomic factors such as tenure status, wealth, and education are predictors of neighborhood satisfaction, this was not found to be the case in our paper, and nor was physical activity. The difference between the neighborhood satisfaction response living in the most deprived areas with least deprived neighborhoods was equivalent to the combined difference between the most extreme categories from status. So level of social engagement was similar to relationship status, sex, and country of birth. This suggests fragility of neighborhood satisfaction in more deprived neighborhoods, as perceived expectations regarding belonging, vandalism, and other areas of neighborhood satisfaction can deteriorate faster compared with less deprived neighborhoods. However, I'd also like to highlight some limitations, of course, of our paper, quite similar to Dr. Karen Mack's paper, that there's this paper there's little doubt this paper does suffer from omitted variable bias, as are, of course, unmeasured factors that contribute to variation in neighbour satisfaction, and hopefully further research could explore these further. There's also a question whether whether the ELSA sample can be generalized to population it aims to represent. For example, the sample respondents are more likely to be owners and white-headed national estimates from the 2001 census. And this was, to some extent, overcome using the sample weights. So just to conclude, neighborhood satisfaction among older age adults is strongly associated with neighborhood deprivation. And some of the main policy implications of the study is that perhaps improvements to neighborhood quality could ensure that older people are equally satisfied with the places they live in, and perhaps through area-based interventions that aim to create age-friendly cities, and also maybe older people could be encouraged to interact with the place to live in, and especially policies should target those who recently moved, who are older, who are men, those born abroad, and those who are single. So supporting public, private, and third sector organizations to target these type of individuals can ensure they feel better about the neighborhoods to live in. Thank you. So I'd just like to say thank you again to my co-author, Dr. Stephen Givraj, the organizers of this conference, and all the rest of the inspiring presenters today. Thank you.